Thoracic outlet syndrome. Thoracic outlet syndrome, TOS, is the compression of neurovascular structures serving the upper extremity. That is the brachial plexus, subclavian artery, and/or the subclavian vein. The brachial plexus and subclavian artery pass through the scalene triangle, whereas the subclavian vein passes through the costoclavicular space. The patient is prepped for surgery, which includes the placement of a shoulder roll and identification of important anatomical landmarks. The surgery begins with the supraclavicular incision. After the skin incision and division of the platysma, subplatysmal flaps are created, revealing the sternocleidomastoid muscle. Then the sternocleidomastoid is retracted medially. The next structure seen is the anterior scalene fat pad, which carries lymphatic vessels. The anterior scalene fat pad is reflected posterolaterally after the lymphatic vessels are ligated and divided. The structures forming the boundaries of the thoracic outlet are seen next. It is important to identify and protect the phrenic nerve as the anterior scalene muscle is released, mobilized, and divided. The middle scalene muscle is also released, and special precaution is taken to protect the long thoracic nerve. Next, the first rib is transected posteriorly at its neck while protecting the middle and lower trunk of the brachial plexus. Then the procedure continues with an infraclavicular incision. After the incision, the pectoralis major muscle is split, and the subclavius muscle and costoclavicular ligaments are divided from the first rib. The first rib is transected and released from its attachments. The first rib resection is then completed, releasing all the intercostal muscle attachments, alleviating the compression on the neurovascular structures. After the procedure, patients are encouraged to resume full range of motion as soon as they can tolerate it. Post-operative physical therapy is a very important aspect of recovery, and it is usually initiated between 3 to 5 weeks from the surgery, depending on the recovery and pain control.